and the EMT staff. We're talking about police officers and firefighters and truck drivers and pharmacists, people who work in pharmacies. We're talking about all of those people who are out there today in these difficult and dangerous times who keep the nation going. So I just want to give a heartfelt thanks to all of you for what you are doing. Your service to our country will never be forgotten. Let me also thank our musicians tonight. I want to thank Sakamami for their great music. And later on in the evening, we're going to hear from Bon Iver and their extraordinary music. What I want to do tonight is to lay out as best I can in these very difficult times where I believe we are today as a nation in terms of the coronavirus pandemic that we're facing, as well as the economic crisis that we find ourselves in. I also tonight want to suggest to you how I think we can best go forward to address these crises, and further, what lessons we might learn from this moment as we advance into the future in forging a better and more just America. In other words, while tonight and right now as a nation, we have to focus on the crises we face, I think it's worth a minute, though, to be trying to ascertain what we learn from where we are, how do we get to where we are, and what kind of nation do we want to become when all of this is behind us, hopefully sooner than later. Now, frankly, I admit to you, I certainly don't have all of the answers to these questions, nor do I think anybody else does. In recent weeks, I have had the opportunity to, among many other people, talk to some of our leading scientists, trying to figure out, get a sense from them as to where they see this pandemic going. I've also had the opportunity to talk to some great economists, trying to learn from them as to how we can deal with the economic crises that we face. And I got to tell you, none of them have all of the answers either. I think we're going to have to struggle through this unprecedented moment together. And at the end of the program, I look forward to hearing your questions, your comments, and certainly you can email us with your ideas because essentially we are in this together in so many ways. But what I do know about the moment that we are in is that we need an unprecedented response to the unprecedented crisis. In other words, we've never been here before. The reason nobody has any great answers is we've never been in a position like this, where we have seen a terrible health crisis in terms of the pandemic, of the coronavirus, and at the same exact time, we're seeing an unprecedented economic downturn. So we have got to work together to figure a way out of this, and I just want everybody to know that along with other members of Congress, I am working on a major piece of legislation, which I'll be discussing tonight, that I believe can effectively address these horrific times that we are living in. Let me begin by saying that clearly the immediate crisis, the most pressing crisis that we face, is to make certain right now that anyone whose life is being threatened by the coronavirus gets the best medical care possible. And when I say anyone, I mean anyone, because it is absolutely imperative that all people, no matter what their income level is, no matter what their station in life is, no matter where they live, gets the best possible health care today that they can. And I am concerned that in many cases we are not seeing that if you're poor, if you're living in a minority community, you may not be getting the kind of health care that other people are getting. And that's an issue we have to focus on. As I think all of you know, as of today, some 8,000 Americans have already died from the COVID-19 virus, and over 300,000 have been infected. Clearly, our job now is to keep that death rate and infection rate as low as humanly possible. And among many other things, what that means is that the President of the United States, in a very forceful way, must use all of the provisions of the Defense Production Act to make certain that the private sector starts delivering the equipment and products that our medical personnel need in order to treat their patients. And let's give you an example of what I'm talking about. Dr. Wayne Riley, the president of the State University of New York Downstate Medical Center in Brooklyn, New York, said today, that his medical staff will have to start using rain ponchos and garbage bags instead of surgical gowns, and that his medical center only has enough gowns, protective gowns, to last for another day and a half. Can you believe that? This is in a major medical center in the largest city in the United States of America, and they're going to have to be using garbage bags to protect themselves. But of course, this is not unique to New York City. What we are seeing is that all across this country, our doctors, our nurses, and other medical personnel are putting their lives on the line to treat patients, to take care of patients, because they don't have adequate personal protective equipment. It is hard enough to do the kind of great medical work that our doctors and nurses are doing under the best case scenario, but imagine doing that when you don't have the protective equipment, the masks, the gowns, the gloves that you need. And in the wealthiest country in the history of the world, to say the least, that situation is totally, totally unacceptable. As a nation, right now, we must determine in short order, what do we need and how fast can we get those products into the hands of our medical personnel and to all Americans who might need them. And I'm talking about face masks, we're talking about gloves, we're talking about gowns, we're talking about necessary hospital beds and ventilators, as well as the various kinds of testing kits that we need now and will be needing in the future. And furthermore, I am also talking about the dwindling supply of certain prescription drugs that are needed to treat this virus. What we are hearing now from hospitals, doctors' offices all over this country is they're running out of the prescription drugs they need to treat people who have been impacted with the coronavirus. In other words, the federal government must make a clear determination of exactly what we need. And we must start producing and acquiring those products as quickly as possible. States and hospitals in America should not have to compete against each other for a scarce and limited amount of product. The federal government must take the lead in coordinating efforts and in doing everything possible to make sure that all medical personnel throughout this country have what they need in order to do the important life-saving work that they're now doing. Further, we must also require OSHA to adopt a strong emergency standard to protect healthcare workers, patients, and the public during this crisis. And most certainly, we must crack down aggressively on price gouges and hoarders. Now is the time for all of us to work together to save lives. It is not the time for companies to be making huge profits. It goes without saying that this crisis has been exacerbated by Trump's initial downplaying of the crisis, his many inaccurate and misleading statements, and his inability to respond effectively to the dimensions of the pandemic. As a result, tragically, many, many lives will have been lost. During this crisis, it seems obvious to me that every American must be able to receive all of the health care that they need without out-of-pocket payment. As all of you know, our country was facing a catastrophic healthcare crisis before the pandemic, with some 87 million Americans uninsured or underinsured, and with us paying by far the highest prices in the world for prescription drugs. The layoffs that we are now seeing will mean that millions of people more will be losing their insurance, which could result in countless deaths and bankruptcies. In other words, when people are being laid off, they're not only losing their income, they are losing their health care as well. Already, in the last 2 weeks, an estimated 3.5 million people have lost their employer-sponsored insurance, and that number will clearly go up significantly in the coming weeks. 14 states, as you know, still have not expanded Medicaid, and increased Medicaid enrollment will put a tremendous strain on state budgets. According to various reports, the cost of hospital treatment for the coronavirus amounts to tens of thousands of dollars. Now, amazingly, what the last stimulus bill did is it said, okay, we will pay for you to get the tests that you need to determine whether you have the virus. But it does not pay for the treatment that people need if they have the virus. And that is, to me, totally absurd. And tragically, what we have already seen are people who have delayed treatment due to concerns about cost. They just don't have enough money to pay tens of thousands of dollars for treatment in a hospital. In this pandemic, uninsurance could well lead to unnecessary deaths and people not getting the treatment they need, which leads to the transmission of more and more virus to unsuspecting people. In order to solve this crisis, in my view, Medicare must be empowered to pay all of the deductibles, co-payments, and out-of-pocket health care expenses for the uninsured and the underinsured. No one in America who is sick, regardless, by the way, of immigration status, should be afraid to seek the medical treatment they need during this national pandemic. Obviously, we are facing not only a pandemic crisis, but we are facing an economic crisis as well. As I think all of you know, last week, 3.3 million people filed unemployment claims. This week, that number doubled to more than 6.6 million claims. That is, over a 2-week period, almost 10 million people have filed for unemployment. And that is far, far more unemployment claims than any time on record. Incredibly, more people have already lost their jobs in this downturn that we are experiencing right now than in the entire Great Recession of 2008, the Wall Street crash of 2008. Frighteningly, the St. Louis Federal Reserve projects that 47 million more Americans may become unemployed by the end of June, with unemployment reaching 32%. Now, that is what the St. Louis Fed is projecting. I certainly hope that they are wrong and that unbelievable level of unemployment does not take place, because that would be a disaster for the working families of our country. And we must, as we go forward, do everything that we can not only to prevent that disaster, but we also must prepare ourselves for a worst-case scenario. And that is kind of what the legislation that I and others are working on. What we're trying to figure out is what is a worst-case scenario and what role can the United States government play to protect the working families of this country. And I think the main point that I believe we must follow and appreciate is that our goal should be to prevent the collapse of our economy rather than figuring out how we can put it together after it crumbles. Okay, in other words, it is a lot easier to try to maintain the economy rather than putting it together after we have massive unemployment, hunger, and incredible stress on the part of the American people. And I think the most effective way to do that, simply stated, is to make sure that every worker in our country keeps receiving his or her paycheck. As some of you may know, in the last stimulus bill that was passed last week, Congress appropriated over $25 billion as part of that $2 trillion bill. Over $25 billion was appropriated in grants to the airline industry so that 2 million workers in that industry could continue to receive their full paycheck and benefits through September 30th. So let me repeat that, what we did for the airline industry. What we did is give them a large sum of money which goes directly to the 2 million workers in that industry who, through the end of September, will continue to receive their paychecks, whether they are working, some of them are, or whether they are not, most are not. And they will also continue to get their benefits. In other words, they have been made whole. And in my view, that is exactly what we must do for every worker in America. And I know people out there say, wow, this is really a radical idea. The truth is, it is not, because it makes a lot more sense than the alternatives that we might be seeing if we did not go forward in this way. And it is also very similar to the programs that now exist today in the United Kingdom, in France, Norway, Denmark, and other countries. In other words, what these countries are saying is that the best way to maintain their economy and the well-being of their working people during this crisis is to make sure that all of their workers continue to receive their paychecks. In my view, if we are to keep the economy